Hello, everyone, and welcome. We are going to be sharing more information about Melissa Selby's changes to her practice in our informational webinar. Before we get started, I would like to share more information about Melissa. Melissa received her bachelor's and master's degrees in nursing from Mercer University. She is board certified as an anti-aging medicine practitioner and is completing her certification in peptide therapy through A4M. She has worked for Vine Medical for the past 5 years as a functional nurse practitioner and has directly worked alongside of Dr. Suzanne Turner, who is an expert in peptide therapy and cellular metabolic optimization. Melissa is known as an expert in the management of hormones, sex, stress, and thyroid through all stages of life. She has a particular interest in helping patients struggling with hormone imbalance and energy inefficiency, weight gain and insulin resistance, autoimmunity, Hashimoto's, Crohn's and rheumatoid arthritis, infertility, and Lyme disease. So I'd like to turn it over to Melissa, who will be sharing more about the changes within her practice. Melissa, take it away.
Hi, everyone. Thank you so much for taking the time out of your day to just listen to this quick webinar, just a few minutes to just answer some common questions and explain more about the changes that will be coming. So as you are all aware, there have been a lot of changes in healthcare, and in some cases they are getting worse. Many of you have, I'm sure, lived through the health insurance premium costs increasing, as well as drug costs and hospital costs. Moreover, insurance payments to providers is decreasing. So providers get less appropriately compensated for their time and for their knowledge. And what we are looking to do, one of the goals of switching the way that I'm practicing medicine and the way that Dr. Turner has been practicing medicine, is stepping away from allowing insurance to dictate how we practice medicine and provide care to our patients. So our goal in all of this is to put you, the patient, back at the center of the healthcare experience and not letting the insurance company dictate how and when we can treat certain issues, or even whether issues can be considered official diagnoses or not. So this really allows for us to take a very proactive approach in true preventative medicine, in both the testing and in steps that we can do to optimize health at an early stage before the diseases get away from us. This also allows us, though, to assess the most cutting edge treatments, the hottest research off the press in order to treat those individuals who are going through more intense and advanced disease states, with the hopes of actually seeing improvement, whereas perhaps traditional models have become stagnant due to lack of research or lack of open-mindedness. So what I'll be offering is personalized medicine. So I'd like to explain that a little bit. People think of us as functional care providers, but I actually had a client speak to me recently and say, you know, I've seen functional medicine providers before you, and they'll just give me a B12 shot or a probiotic and say, well, here, this should make you feel better. But that's not really the way that functional medicine is meant to work, and it's certainly not the way that traditional medicine can work. Traditional medicine tries to put patients in boxes. You have high blood pressure, you get a high blood pressure medication. Functional medicine may also be guilty of the same thing. If you have fatigue, oh, well, a B12 shot should help you to feel better. That is not personalized. People do not fit into boxes. Each individual person requires their own unique workup and approach to their health. And so that is what I am hoping to get to do with all of you who will be signing up with my program, is taking the extra time and using the extensive knowledge that I've gained over the years of study in order to create a personalized, tailored approach to each and every one of you and the health concerns that you may have, again, either preventative or from a treatment symptom management approach. So again, the way that we'll do that is as we get to spend more time with one another, and as I will have the ability and the margin to be to have open lines of communication with you all, then we'll be able to build a relationship together. And it's in that we really get to find details that may help to bring to light answers to health questions that may have been going on for years. And also, though, will allow us to continue to, again, build that tailored treatment plan. Again, and as that goes along, and for those of you who haven't gotten to work with me already, the building of that trust and knowing that I'm here to partner with you, not just to tell you what to do, that will be how we work together as a team to achieve your optimal health. So benefits of membership, forgive me, I'm just going to read straight from this slide, but interject a few details. So expedited office visits with longer appointment times, that will be the biggest benefit to this practice. I'm looking forward to spending an hour and a half with you all at your physical exam. Should you want it, you don't have to, of course, and longer office visits as well as offering telehealth visits when that's appropriate. I will have a dedicated staff for scheduling, answering phone calls, taking care of immediate needs. Again, the whole point of this type of practice is a detailed and in-depth focus on wellness and disease prevention. Again, I am traditionally trained, but have spent many years learning the functional side of medicine. So I'm offering both. I do all the regular primary care stuff, pap smears, mammograms, all of that. But then what I have found is that often with certain disease states, we end up marrying the two, joining the traditional with the functional medicine to create the best personalized approach for each and every one of you. We use advanced testing to assess a number of these things. Again, additional blood work, saliva testing, urine testing that many patients weren't even aware existed before coming to us. And that is what allows me to better understand how to help my patients physically and mentally, emotionally. Advanced screening tests, additionally, all the traditional stuff, again, should it be appropriate, bone densities, calcium scores, that sort of thing. The executive style physical, again, I've mentioned before, look forward to spending a good chunk of time with patients for their physical and in offering some additional tests to assess for health that I have not been able to offer before. Things like a body composition analysis, which will be included in every physical, as well as in follow-ups if it's appropriate. I've recently gotten a new toy, a grip strength assessor, which is also a really good marker for the aging process. We like to say that muscle mass is the currency of aging. And so one of our goals will be maintaining the muscle mass of my patients. A deeper dive into complex chronic health issues. It hurts my heart when patients tell me that doctors have just been telling them that they were crazy for years before they came to see me. A lot of times there are just a lot of stones that have been left unturned in assessing these chronic issues, and I look forward to jumping into those with you. Quarterbacking and advocating care with your specialists. With the additional time that this program will allow me to have, it will be more feasible for me to call specialists, ask how I can be a further service to them, let them know what the plan is, explain to them what we're doing if what we are doing is a little bit well, we'll say if it's new, a technically off-label treatment, but supported by research, of course. So that's the sort of communication that I'll be able to have. And then Dr. Turner and myself have been developing relationships with specialists in the area. So it will be an easier thing for me to literally pick up the phone and text someone, hey, can you get this patient in for me today? As a favor, I'd really appreciate it. And again, just being able to offer that kind of service to my patients. Body composition and metabolic testing. Again, we do that through a variety of measures, both by blood, saliva, urine, as well as the body composition analysis machine that we have in the office. Events for members, we'll see how the next year goes in terms of COVID, but that is something that we look forward to offering. Again, just an evening in the office now and then where we offer refreshments and just get to, enjoy each other's company as friends and colleagues. And then discounts on peptides, pellets, IV therapies, and supplements. Another big benefit of this new program. Anything that will be coming through us, again, whether it's testosterone pellet therapy will probably be the most deeply discounted process that will be part of the program. But if cost is an issue with any of the plans that we're developing together, please let me know, because again, sometimes there are additional ways that we can work around that as well. So how does health insurance fit into this picture? So the membership fee is apart from health insurance. However, FSA, HSA money can be used to cover it. The office visits will be billed to insurance. However, if you do not have health insurance, or if your health insurance has such a high deductible that your insurance requires you to pay out of pocket entirely for visits until that deductible is met, we've worked out a deep discount for that as part of the program. Obviously, the membership fee is a sticking point for many, but I would ask you to consider how much you're spending on a day-to-day basis, maybe not every day, but on a regular basis, on things that may not seem that big to you, but that may add up. Things like your monthly prescriptions. If you're paying, $150, $200 a month for your prescriptions, and perhaps that prescription isn't the right thing for you, or perhaps there's a cheaper alternative, or perhaps I could get you in touch with a pharmacy or a program that could offer you a deep discount on that medicine. That's the kind of way that I would love for you to approach it, is how, in considering the program and whether it's right for you, consider perhaps, are there other areas that you are spending your money that may actually be stealing from your health, or at least not promoting it? Whereas perhaps this program would be a way for you to take that back and make some changes in 2021 and moving forward. So the annual membership fee is $3,000 per individual, $5,800 per couple, which is a $100 discount per person. The fees may be paid annually, semi-annually, or quarterly. And again, to be clear, this membership fee is in addition to having health insurance to cover office visits, or again, if you don't have health insurance, or if your insurance has such a high deductible that you'll be paying out of pocket, please let us know this, because we can work out a discount for you and bill accordingly. Space will be limited. This program is really exciting, and I really look forward to working with you, but please do reach out to Jody as soon as you can so that you can become a member, join the practice.
Great. What awesome information, Melissa. Thank you so much for sharing that. I know folks that are watching this video recording are going to be just equally as excited. I want to make sure that everyone knows how to reach out to me. On the screen, you have my direct phone number, my email address. Again, Melissa is only going to have 100 members as part of her patient panel. So it's very important. Just as we are making this recording, we are about more than 50% full at this point. So there is only limited spots. So please do get in touch with me. Just as Melissa has mentioned, there are ways to be able to break this up into payments. We do offer the quarterly payment program or semi-annual, but we will need to get a payment in order to secure your spot. The membership will begin as of February 1st. So it's important that, and many people are already jumping on board and making that first payment so that they can secure their spot. So again, the membership does start, and it is an annual membership as of February 1st. And the price per person is $3,000, or the couple rate that we also have available. So again, please get in touch with me and I will get you signed up as soon as possible to save your spot.
May I say one more thing, please, Jody?
Absolutely.
So if you have any questions, and especially if we haven't gotten to meet one another before, I'd love for you to reach out to Jody and ask her to set up a meet and greet. So this will be the best way for us to have a quick 10 to 15 minute discussion where you can tell me a little bit about your health, and I can go through some of the plans that I would have for you, the tests, just some basic suggestions. It wouldn't be a true consult per se, but that way you could test the waters, so to speak, without making that investment, to know if it's right for you and just to see if we click. So again, please feel free to reach out to Jody for that service if you'd like.
Yes, great points, Melissa. And we want it to be a perfect fit for everyone. So we definitely welcome that opportunity if you are new to Melissa and new to Vine Medical. So let's go ahead and step into the next session, which is our question and answer. And we do have questions that we have received that are common questions that we receive about the program. And I know that Melissa has mentioned some of these points as part of the talking points that she's made. But just to clarify, as far as HSA, FSA, that is a common question that has come up as part of membership. Melissa, do you want to add any additional points about how that will work with a person's HSA or FSA?
So HSA, FSA can be used to cover the annual membership, however it's split up. And then of course, since we will be prescribing supplements, peptides, etc., it can be used to cover those as well.
Perfect. Another common question is, how does this work with insurance again, as well as the copays?
So insurance will still be considered in terms of any imaging studies that we order, blood work, although that would be something that we would discuss, since sometimes these labs are actually cheaper when run through cash pay option versus going through insurance. So we take insurance, as well as, of course, the cost of all of the tests and treatments that we offer, and we just work together to decide what is the most cost-effective way for us to get those treatments or run those tests, whether it is as a cash pay option or running through insurance.
Great, thank you. So if I'm a patient and I'm unable to actually follow you in this new membership style practice, what will happen to me if I decide I'm not able to join?
So we have two excellent mid-levels in the practice, Danielle and Molly. So they will be still taking patients and following up with current patients in terms of hormone management, physical exams, etc. So the front desk will be more than happy to get our patients scheduled for whom the program is not the right fit, get them scheduled with Danielle or Molly.
And how many patients are you taking in this new practice? And what happens if you do reach capacity?
We're taking 100 patients in this new practice. After we hit capacity, there will be a waiting list.
And what happens if you go on vacation?
When I go on vacation, Dr. Turner will cover for me in terms of handling and taking care of any patient correspondence that may go on. And similarly, I will cover for her when she's on vacation or attending conference.
And one last question, will you be raising your fees?
We are going to be freezing fees for 3 years.
And just to clarify, that will be for anyone who's joining now. However, Melissa is able to raise her rates for any new patients that might be joining.
Thank you for clarifying.
And that's our last question.
Okay, well, thanks again, everybody, for taking your time to watch this little webinar, and hope you have a wonderful day.